Following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to Let's Talk Hormones with Carolyn Zallmeyer. Take some time with me this evening to learn how to age healthier and live happier. Today we'll be discussing how hormones can affect all aspects of your health and well-being. I've been specializing in women's health and hormones for over 28 years and focusing in on bioidentical hormone therapy for both men and women for the past several years. We talk hormones, we don't talk sex, we talk health, aging, wellness, and relationships, and well, maybe a little bit of sex. So let's get this party started. Good evening and welcome to Let's Talk Hormones with me, Carolyn Zallmeyer, bioidentical hormone expert. We're live streaming tonight on Facebook and on the LowTEFlorida page. And the fun part of this Facebook feed is that you can watch it over and over. And you can also refer your friends to it. If there's something that you hear tonight that may be appropriate for a friend or a family member, you can always share the feed and they can watch it on Facebook as well. So if you have any questions, we're going to be accepting phone calls this afternoon or this evening, and we'll be able to take your questions and answer them. We're also live on 95.3 FM, 1470 AM, WNN, the Health and Wealth Network here in South Florida, and we're also on the iHeartRadio app nationwide and can be found under WNN 1470. During the next 30 minutes, if you have any questions for me about the topics, any aspects of bioidentical hormones, or our topic tonight, osteoporosis, I would love to hear from you. Please call 1-888-565-1470 and we'll answer your questions. Or you can send your questions in through Facebook at LowTEFlorida. Tonight's topic is osteoporosis. What is it? Why do we need to know more about osteoporosis? Who gets it? What can we do to prevent it? And what can you do if you've already been diagnosed with either osteopenia or osteoporosis? And stay tuned, guys. This isn't just for women. Many men also suffer with osteoporosis or osteopenia, thinning bones. The definition, what is osteoporosis? The International Osteoporosis Foundation defines it as literally porous bone, the porosis part of the word, and osteo is bone, a disease in which the density and the quality of the bone is reduced. As bones become more porous and fragile, the risk of fracture is greatly increased, and the loss of bone occurs silently and progressively. So you can be losing bone and not have any idea about it, and it could cause you problems down the road. So what is bone? Bone's a living, growing tissue. It's made mostly of collagen, a protein that provides a soft framework, and calcium phosphate, a mineral that adds strength and hardness to the framework, to the outside of the bone. This combination of collagen and calcium makes the bone both flexible and strong, which in turn allows the bone to withstand stress. More than 99% of the body's calcium is contained in the bones and teeth. The remaining 1% is found in your blood. So why do we need to know more about osteoporosis? And why am I passionate about osteoporosis? It's a debilitating disease that can be prevented and or corrected naturally with bioidentical hormone therapy. Ignoring osteoporosis can lead to living through your golden years with major medical issues that are preventable. So why not prevent it? Broken bones, emergency room visits, major surgeries, pain, and even death. I want all of my patients to be able to live full and active lives for however many years we have left. We never know how many we have. It could be a whole bunch. Those of you that have heard me speak may remember my visual of women aging naturally. You know, take an apple, leave it out on your countertop for about 3 months, then go take a look at it, aging naturally. Without the benefits of bioidentical hormones, it's not good. It certainly isn't how I want to age. Our bodies are designed to function with hormones, and without them, our bodies suffer. Our skin needs the support of estrogen to keep it plump and moist, just like the before apple, not the after. Estrogen has over 400 functions in the body. Testosterone has over 100 functions in the body. When we're no longer producing it, our bodies suffer inside and out. Whether we can really put our finger on it or not, we're just not functioning the way we should, and maybe not feeling our best. So hopefully tonight you'll understand how hormone optimization can lead to a better old age. We can help you age healthier and live happier. Unless we've been screened for osteoporosis, we usually don't know we have it until we fracture a bone. I remember ladies that would walk by and just gently hit their wrist on a table and crack a bone because their bones were so brittle. And the absence of hormones can lead to osteoporosis, totally preventable and at most times reversible. I've had the unique opportunity with my practice to actually see improvement in bone density in my patients by simply optimizing their hormones. I've provided gynecological services here in South Florida for over 28 years. Over the years, when I've ordered bone density tests for my patients, the results come back and basically show one of three things. Either it's normal, which is fabulous, keep doing what you're doing, or osteopenia, that's a low density of the bone, meaning you have the increased chance of it developing into full osteoporosis. So we need to be proactive so that it doesn't go into osteoporosis. Or sometimes it's full-blown osteoporosis, which literally means porous bone, and it is a disease where the density and the quality of the bone is reduced. As the bones become more porous and fragile, the risk of the fracture is increased. The loss of bone occurs silently and progressively. Throughout one's lifetime, old bone is removed through reabsorption with the osteoclast cells, and new bone is added with the to the skeleton by formation by the osteoblast cells. During our childhood and teenage years, new bone is added faster than the old bone is removed. And as a result, our bones become larger, heavier, denser. Bone formation outpaces reabsorption until peak bone mass, meaning the maximum bone density and strength, is reached around age 30. After that time, bone reabsorption slows down and begins to exceed the bone reabsorption. Symptoms. Osteoporosis is often called the silent disease because bone loss occurs without any symptoms. People may not know that they have osteoporosis until their bones become so weak and a sudden strain, bump, or fall causes a hip to fracture or vertebrae to collapse. Collapsed vertebrae may initially be felt or seen in the form of severe back pain, loss of height, or spinal deformities such as kyphosis, that severely stooped posture you've seen on some elderly ladies. Remember the elderly ladies with the dowager's hump? This is a sign of advanced osteoporosis, the result of compression fractures and weakened vertebrae. So who gets osteoporosis? Well, anyone can get osteoporosis, but women are about 4 times more likely than men to develop it. And there's 2 main reasons for this. The process of bone loss speeds up for several years after menopause when the ovaries stop producing the sex hormones. Men generally reach a higher level of bone density before the process of bone loss begins. Bone loss still occurs in men, but it has to be more severe before osteoporosis occurs. But that doesn't mean you guys are out of the woods, so keep listening. Although the lifetime risk of hip fracture is lower in men than in women, men are twice as likely to die after a hip fracture. Twice as likely to die after a hip fracture, not good. According to the International Osteoporosis Foundation, 1 in 5 men over the age of 50 will have an osteoporosis-related fracture. This is greater than the likelihood of developing prostate cancer. So let's stop the nonsense with this osteoporosis. For women, bone loss is fastest in the first few years after menopause if they haven't had the benefits of hormone replacement therapy, and it continues into the postmenopausal years. Osteoporosis, which mainly affects women, but it may also affect men, will develop when the bone reabsorption occurs too quickly or when the replacement occurs too slowly. Risk factors. Certain risk factors are linked to the development of osteoporosis and contribute to an individual's likelihood of developing the disease. Many people with osteoporosis have several risk factors, but others who develop the disease have no known risk factors. Some risk factors cannot be changed, but you can change others. Risk factors that you cannot change are your gender. Your chances of developing osteoporosis are far greater if you're a woman. Women have less bone tissue and lose bone faster than men because of the changes that happens with menopause. Age, the older you are, the greater the risk of osteoporosis. Your bones can become thinner and weaker as you age. And body size, small, thin bone women are at a greater risk. I guess I'm safe. Ethnicity, white, Asian women are at highest risk. African American and Hispanic women have a lower but significant risk. Family history, fracture risk may be due in part to hereditary. People whose parents who have had a history of fractures also seem to have a reduced bone mass and may be more at risk for the fractures. Risk factors you can change. Sex hormones, getting your hormones optimized. low estrogen for women through menopause and low testosterone for men during andropause levels can bring on osteoporosis in both men and women. Anorexia nervosa, well, that's basically saying that if you're not eating well, if you're not giving your body the nutrients and the foods and minerals that it needs, that it could affect the bone. Vitamin A, D, and K intake, a lifetime diet low in vitamins and minerals, makes you more prone to bone loss. And medication use, long-term use of certain medications such as glucocorticoids like prednisone and some breast cancer and prostate cancer drugs, some heartburn drugs, the contraceptive Depo-Provera, excessive thyroid medications, diuretics, and some anticonvulsants can lead to loss of bone density and fractures. So if you're taking any of those, you need to have your bone density done to check in on it. Chemotherapy and radiation also can affect the bones and create a bone loss. Lifestyle, an inactive lifestyle or an extended bed rest tends to weaken the bones, so we need to get out and keep moving. Cigarette smoking. Smoking is bad for the bones as well as the heart and lungs. Alcohol intake. Excessive consumption of alcohol increases the risk of bone loss and fractures. And low sex hormones. Let's optimize those hormones. We're going to take a quick commercial break, and when we get back, we'll discuss the study that backs up what we've just discussed and answer more of your questions. Thank you for listening to Let's Talk Hormones with Carolyn Zellmeyer. Many men and women are feeling tired, moody, having difficulty sleeping, gaining weight, and have no desire for intimacy or exercise. These symptoms can be caused by reduced levels of hormones that occur naturally as we age. You'll be happy to learn there's an exciting, safe, and natural solution available at LowTEFlorida. If you'd like to learn more about how LowTEFlorida can safely balance hormones for both men and women, call today or visit our website at LowTEFlorida.com. You've been listening to Let's Talk Hormones with Carolyn Zellmeyer. I hope I've made you feel comfortable enough to call in with your questions. The phone number is 888-565-1470. Now, let's get back to the show. Hi again. The studies. In 2008, there was a fabulous study by Dr. Bart Clark and Dr. Coleslaw that support my thoughts affecting hormone therapy and bone health. They concluded that testosterone and other androgens exert major beneficial effects on the bone cells and skeletal growth and homeostasis, with actions mediated by both androgen receptors and estrogen receptors after aromatization of the androgens. Both the androgen and the estrogen receptors play important roles during the bone remodeling. I know that may sound Chinese to you guys, but it sounds like music to my ears. So besides my seeing it clinically for the last many years, a research study published in the American Journal of Obstetrics and Gynecology concluded that testosterone is a bone builder. The study demonstrated a 4-fold increase in the bone density using bioidentical hormone pellets versus oral estrogens and 2.5 times greater than the patches. Having consistent delivery of hormones through the pellet system makes all the difference for rebuilding your bone. Traditionally, we were recommending calcium supplements to prevent osteoporosis. However, over time and much research, we've learned that vitamin D plays a much more important role in reducing the risk of fracture. In a meta-analysis, which means basically, in this case, the results of 29 studies brought together and analyzed, it shows a non-significant reduction in the risk of fracture with calcium alone. So calcium isn't the answer. Vitamin D alone does reduce the risk of fracture by 16%. Then we pair it with the testosterone, we get a fabulous result. So what can we do to prevent and treat our bone loss? Even if we don't fit the traditional high-risk marks, thin white women, we may still be at risk. We can ensure a nutritious diet, getting in the green leafies and the calcium and the vitamin D and eggs and such that your body needs to create new bone. Avoid undernutrition, particular effects of severe weight loss diets and eating disorders. Maintain adequate supply of vitamins A, D, and K. You must have K2 to activate D3, so that combination is important. and participate in regular weight-bearing exercise. And what that means is basically walking or jogging, putting some weight on your bones to help stimulate the regrowth. Lifting weights, strength resistance training is also good. Push-ups, squats. Avoid smoking and secondhand smoke. Avoid heavy drinking. And most importantly, optimize your hormones so that your bones can age healthier, along with some of the other benefits of bioidentical hormone pellets, such as more energy, mental clarity, increased sex drive and sexual satisfaction, decreased joint pain, and much more. We have a question came in from Susie in New Jersey. How is osteopenia and osteoporosis diagnosed? Osteopenia is diagnosed with a bone mineral density test. It's the most accurate way. The dual energy X-ray absorption dendrometry, the DEXA scan. We always hear about the DEXA scan. It's a form of X-ray that can detect as little as 2% bone loss per year. Very, very good. A standard X-ray is not helpful in diagnosing osteoporosis due to its lack of sensitivity. Many women will have DEXA scans a little bit too late once they've already found out that they have osteoporosis. So at our practice, we encourage you to have them earlier. If you have some of the risk factors, starting in your late 40s, maybe early 50s, and let's get a grip on it and see what you have. Julie from Tamarack. My doctor has diagnosed me with the beginnings of osteoporosis. He wants me to take Fosamax. I've heard there's side effects about taking the medications for osteoporosis. What are they, and what do you think? Well, some of them that come to mind are ulcers and irritation of the esophagus and the upper GI tract. You have to, after you take it, you have to sit up vertical for a half hour without eating anything else. And that's causing havoc on your upper GI tract. And in fact, in 2010, a study indicated that the long-term use of the oral biphosphonates osteoporosis drugs such as Actonel, Boniva, and Fosamax may be associated with doubling esophageal cancer risks. It can lead to irregular heartbeat, fractures of the femur. We're taking this not to break bones, and it actually can lead to that. Low calcium in the blood, skin rash, joint, bone, and muscle pain, and jaw bone decay. These are some serious side effects, so think clearly before you do that, when you know that you can actually start to rebuild bone naturally by just optimizing your hormones. So even better than that, Forteo, a new daily injection, the lab studies show that in high doses, this drug raises the risk for certain types of bone cancer. So you're going to have strong bones with bone cancer. Though the cancer is extremely rare, the drug can only be taken for 2 years. So you can have strong bones for 2 years, according to the National Osteoporosis Foundation. If potential bone cancer isn't enough, the other potential side effects for this medication include impaired thinking, fainting, feeling lightheaded, rapid heart rate, gastrointestinal problems like nausea, vomiting, and constipation. Sign me up. I'm not taking that stuff. So why not just prevent and correct bone loss with bioidentical hormone optimization? I had a patient the other day that when we discussed the improvement on her bone density studies after 1 year of pellet therapy, she actually began crying. She was so happy that she had made the right decision and started on bioidentical hormone pellet therapy at my practice at LowTEFlorida in Fort Lauderdale. Here's another one that wrote in, Sarah from Miami. How often should I get a bone density scan? Traditional medicine tends to think that you should wait until the cows have already left the barn. The National Osteoporosis Foundation is recommending the DEXA scan should be performed in women age 65 and older and men 70 and older. Most of the times that's going to come out to osteoporosis. We need to know sooner. In postmenopausal women and men above 50 to 69, based on their risk factor profile, meaning they had some risk factors, and in postmenopausal women and men age 50 and older who have had an adult age fracture, to diagnose a determination of the degree of osteoporosis. So they just want to know how much, it's already gone, it's already there. So the test is painless and it's affordable. Without insurance, it's usually less than $100 and it's completely safe. So why not test earlier so that you know what you're dealing with? I don't get it. You will need a prescription for the screening, and it can usually be done at a hospital or imaging center. If you're a patient of mine at LowTEFlorida, I'd happily write you the prescription. If you're diagnosed with osteopenia or osteoporosis, scanning more than once every 2 years is not recommended. It's a very slow change, and so we want to give it a little bit of time to see some correction. Here's another one. Andrea from Palm Beach. My grandmother has osteoporosis, and I'm worried I may get it too. Which food should I eat to help prevent osteoporosis? Well, calcium, this is a mineral that your body needs every day for many functions. Calcium plays a role in maintaining the strength of your bones and teeth, as well as the functioning of your heart, nerves, and blood clotting. Unfortunately, the majority of our population is not taking in the required daily amounts of calcium. When this happens, your body will then use a supply that you have in your bones to support the other functions in the body. For this reason, it's imperative that you meet your daily requirements every day. Your dietary sources of calcium are dairy products, milk, yogurt, cheese, calcium-fortified cottage cheese, green leafy vegetables, broccoli, kale, collard greens, turnip greens, mustard greens, fish, canned salmon, sardines with the bones, nuts, the almond nuts or the Brazil nuts. If you want to get calcium through your foods and not you want to get your calcium through your foods and not through supplements. Calcium supplements have been tied to an increased risk in kidney stones. That can be painful when those pass. We have just a few more questions, a little bit more time if anybody wants to call in. This is about bioidentical hormones. This is from Teresa in Fort Lauderdale. She had written in the other day, is this treatment expensive and does insurance cover this treatment? She's talking about our BioT pellet system. The treatment is not expensive. It ends up being about $100 and change a month to feel really, really well and help give you strong bones, good mood, and energy. The initial consultation is $150. If you do your lab testing with us, it's $195. And the actual pellet system itself is either $350 for women or $650 to $750 for men. So it is affordable. I have many people across the board that are saving up and getting their pellets, from housekeepers and waitresses to anyone else, business owners and such. I also have a question about PTSD because I've referenced before on my show that we have used our hormone pellet system to treat PTSD. And Dr. Donovitz, the founder of BioT Medical, my medical director, he wrote this book, Age Healthier and Live Happier, through hormone optimization, avoid over-medication through natural hormone balance. He did a study with 100 returning war vets, and I tell you, the response was incredible. They have been diagnosed with PTSD, and they felt much better. It's not that we're curing PTSD, but it's helping with the mood swings, with the anxiety, depression, relationship issues, and energy. And they just feel more like getting out and exercising, working, getting back to a real life. So the PTSD study was really fabulous, and we have testimonials that are available on our website, which is LowTEFlorida, with Florida spelled out.com, that you can watch and hear about how these people's lives were changed and benefited from the therapy. This is another funny one. Why shouldn't I just age naturally without hormones? Well, that's our Apple analogy. So why do I need estrogen and testosterone? It just helps you get your zip back, your spring in your step, helps you feel more like your old self, helps with your sleep, your moods, anxiety, depression, even joint pain. So many people just feel better with it. So Shelley from Coral Springs wanted to know, how do you determine the dose that I will need? Well, we have a very scientific way of deciding the dose using a computer program. We can take your medical history, combine that with some of your lab values, and actually calculate scientifically what your dose will be. And that will tell us exactly how much testosterone your body would benefit from, how much estradiol for females would benefit from. If you still have your uterus, it'll tell us a dose of progesterone. And if your thyroid, it needs to be optimized, it'll tell us exactly what to write the prescriptions for. And then it'll also give nutritional recommendations such as vitamin D. Instead of guessing at the vitamin shop, it's going to tell us exactly what you need to be taking. It'll recommend probiotics, omega-3s, iodine for thyroid supplementation. So it'll give us a nice starting place for you so that you'll be able to be treated well. get your first dosing, and then we recheck your blood and check in with you at 6 weeks, just to make sure that you're doing well, that you're feeling well. That's most important. And check your levels and see if there's anything we can improve upon. One more. Here we go. Amy from Hollywood. I don't sleep well at all. Could this help me? Absolutely. That's one of the first things that a lot of people notice, is that their sleep may become improved with time. A lot of times, and this sounds silly, but I've gotten calls the next day from many patients saying they had actually slept better the very first night after treatment than they had in years. I know when my pellets start to wear off, that's one of the things I notice, is my sleep does become more disrupted. I'll be waking up at 3 o'clock going, okay, it's not time to get up yet. So that may be one of the signs that your hormones may need to be optimized. So next week we will be having a fun show. It's going to be, we're having a couple of my patients come in and do actual testimonials. So if you'd like to learn more about optimizing your hormones, age healthier, living happier, go to our website, LowTEFlorida.com, or simply call my office at 954-791-4498 to schedule a consultation with me, Carolyn Zallmeyer. I hope to see you soon at LowTEFlorida. Be sure to tune in next Thursday at 7 p.m. for my next show. We'll be having guests come in who have had their hormones optimized with our BioT pellet therapy, and they will share their experiences. See you next week. Thank you for listening. Thank you for listening. It's my mission to help men and women live their best lives, and I hope that today's show gave you just a little motivation to do so. If you'd like to learn more about bioidentical hormones and if they're right for you, please call my office to schedule a consultation, 954-791-4498, or visit our website, LowTEFlorida.com. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its